So we are having an eminent personality with us, Dr. Nikunj M. Trivedi. He is a DHMS gold medalist. He got his PG Homeopathy from London. He is one of the collaborator at Radar Opus Archibald and creator of Repertory of Infertility. Dr. Nikunj M. Trivedi is honored as the Fellow HMA UK. He is a Fellow at British Institute of Homeopathy. He is associated with many homeopathic institutes in UK and India. He is the faculty of Hahnemannian College of Homeopathy, UK. He is the Honorary Director of Education and Research, HCH. Let us welcome Dr. Nikunj M. Trivedi, and the subject is Management of Digestive Disorders with Homeopathy.
So I extend my warmest welcome to all the participants with the IFPH. Today is 822nd day, and that what I told you, that now we are not that far from achieving 1000 day of our IFPH regular webinars. It's a great achievement for the homeopaths and for the IFPH as well, by sharing the treasure of knowledge from various homeopaths from various countries, different countries, and really we all are delighted to know something from all the homeopaths. So today, last time in my webinar, one of my senior doctor has asked me about hiatus hernia. This time I'm going to discuss about the hiatus hernia in my topic. Yes, this is the second part of digestive disorder. And as last time we discussed about what Hahnemann has taught us. Hahnemann told that I have not lived in vain. Let us say all together that we have not lived in vain. We will not live in vain, because we are the proud homeopaths best in the world, and we are doing the best within our limitations of our system. So this will make us to feel proud about what we are doing. Yes, digestive disorder and homeopathy, the one-way system. And I will discuss this topic with my unique protocol, which I have developed after my 43 years of clinical practice, where I consider the clinical part as a prime importance. I select the remedy while considering the clinical aspect of the patient's condition, correlating with the drug picture, and then I'll select the medicine. And with that, as Hahnemann has told us, to bring back the abnormal pathology to the normal physiology. And that is what Hahnemann has written in first aphorism. Restore the sick to health, means restoring the abnormal pathology to the normal physiology, and that is the prime duty of a physician or a homeopath. Yes, today I'm going to discuss about the esophageal disorder. It's a collection of conditions that affect the esophagus. And we want to know that how esophagus works. Let us understand the esophagus first. The esophagus is a hollow muscular collapsible tube about 10 inch or 25 centimeter, which carries food in liquid from the pharynx, from the throat to the stomach, and it joins the pharynx to stomach. The esophagus runs through the middle of the chest cavity. That is called the mediastinum. And it having a two sphincters. One is at the throat, that is cricopharyngeal sphincter. And another one is the cardiac sphincter, which joins with the stomach. The primary function of the esophagus is the transport of food and liquid from mouth to stomach. And acid reflux is a very, very common condition which we found in each and every country. And now I'll discuss about its statistics as well. So let us discuss about the types of esophageal disorder. First is GERD, means gastroesophageal reflux disease. Second is achalasia, a failure of the lower esophageal sphincter to relax. Achalasia cardia. Barrett's esophagus. Metaplasia of the lining of the esophagus. Esophagitis, eosinophilic esophagitis. Then esophageal spasm. It is related with the peristalsis and antiperistalsis. So it reflects the motility issue of the esophagus. Then comes the esophageal diverticulum. Then comes the esophageal stricture. Then comes the esophageal varices. That is the tortuosity of the azygous and hemiazygous veins. Then comes the esophageal cancer, and last, hiatus hernia. So we'll discuss hiatus hernia today because all the topics we cannot discuss in a session of 1 hour. So we'll discuss hiatus hernia in more detail. So what are the symptoms of the esophageal disorder? That's very, very important. Any patient comes to us with a condition that dysphagia, means difficulty in swallowing, and sometimes we have to convert the patient's language into rubric, like sensation as if something has been stuck in a throat. Splinter-like sensation. So these are the symptoms patients are giving us, and we have to convert that symptoms in a repertorial language or in our homeopathic terminology. So first we consider dysphagia, means difficulty in swallowing. Abdominal pain, chest pain, and referred back pain. Many times the esophageal disorder reflects as a referred back pain. Sometimes patient comes with a chronic cough, sore throat, and breathlessness. Difficulty in swallowing or feeling as if food is stuck in a throat or at the epigastrium. Heartburn is very common condition. Sometimes with the spicy food, many patients complain of the heartburn. We also feel sometimes heartburn after spicy food. But if it becomes a regular incidence of having a heartburn, then it becomes a clinical condition, and then it becomes our duty to treat that condition. Hoarseness or wheezing in a chest. Indigestion, burning feeling epigastrium and at stomach. Patient complains with burning sensation at epigastrium. Food gets lodged at the epigastrium. Food gets lodged as if it's not being going down. So patient has to take a sip of water just to push it down. And burning in stomach as well. So epigastric burning pain and burning pain in stomach will differentiate the two symptoms in a different clinical condition: regurgitation or vomiting. Regurgitation means antiperistalsis. When food goes down from the esophagus to the stomach, then it propagates further in the intestine. But sometime when the intestine is working against the nature, that causes the regurgitation, and then food comes straight away to the throat. And unexplained weight loss. When patient is unable to assimilate or patient is unable to digest the food, patient is not able to get enough amount of nutrients, patient is not able to synthesize the protein, so wasting takes place, and then patient having unexplained weight loss. And this we will discuss in one condition that is called PV syndrome later on. Yes, gastroesophageal reflux, this is the most common condition in Western world. Here, let us understand the pH of esophagus is alkaline and pH of stomach is acidic. So when acid and alkali are combined, or when acid and alkali they get mixed up, it neutralizes, but before it gets neutralized, it generates the heat. And that's why we are feeling burning at the epigastrium, because at the cardiac end, when stomach starts and esophagus ends, it's a junction. And that area is called the cardiac sphincter. And at the cardiac sphincter, esophagus ends, so alkaline pH of esophagus meets with the acidic pH. And when there is excess of acid in the stomach bowel, it causes sort of a burning. And that's why majority of the time patient complains of the burning pain at the epigastrium. So what are statistics of gastroesophageal reflux disease? In North America, it is 18.1 to 27.8. In South America, 23%. In Europe, 8.8 to 25.9%. East Asia, 2.5 to 7.8. Middle East, 8.7 to 33.1%. And in Australia, 11.6% of the patient having a GERD. And this is the map which will show, and it is highest in the Africa, especially in the Nigeria, because of the food and because of the fluoride content of the water. So when the patient comes to us with the complaint of GERD, what are the investigations are necessary to boost up our diagnosis? So in that case, we always ask patient to undergo a complete blood count, absolute eosinophil count, endoscopy. If patient comes with the endoscopy report, then it will help us to determine the clinical condition, and accordingly we can select the right homeopathic remedy. When patient is undergoing endoscopy, at that time the surgeon is always taking biopsy just to check that what type of condition is there histologically, whether patient is turning to the malignancy or not. And then comes to esophageal manometry, the pressure in the esophagus, esophageal pH test. Radiologically, we can ask about the plain X-ray, barium swallow, and CT scan. Simple esophageal pH test with the litmus paper shows the amount of acid in a breath, and with that we can also rule out the condition which is called the H. pylori, Helicobacter pylori, and which is very, very common nowadays. So trigger factors for the GERD. If we consider the food, then fried or fatty food, citrus food, fruits and beverages, chocolates, coffee, fizzy drink, carbonated beverages, alcohol, and smoking. Medications, alpha blockers, anti-inflammatory like ibuprofen, diclofenac sodium, naproxen, like that, and sedatives. Nitrates, amyl nitrates. When patient having a angina, patient is all the time on the nitrates, and that is also causing a sort of a trigger factor of the GERD. With that, patient is also developing a sort of a hyperacidity. And in allopathy, majority of the physicians, surgeons, they are prescribing the PPI, proton pump inhibitors, like antacids also, they are prescribing PPI, like omeprazole, lansoprazole, pantoprazole, like medications they are prescribing, and with that, the secretion of the acid remains under good control. So patient doesn't get hyperacidity, but it's a called suppression in our language. So symptoms get suppressed, secretion of acid gets suppressed, and with that patient is developing more and more indigestion, bloating, distension, belching, and passage of flatus. And these all symptoms you will get as a bad effect of proton pump inhibitors in only one remedy, that is the lycopodium. We'll discuss later. Okay, let us discuss GERD manifestations, gastroesophageal reflux disease manifestation, and the symptoms of hiatus hernia I primarily attributed as GERD. So the protrusion of an organ, typically the stomach, through the diaphragm. Stomach pops out. The fundus part of the stomach comes out from the diaphragm. Esophageal opening is becoming a bit wider, and from that the stomach pops out, which is found most commonly in females and usually after 50. And here I have put a question mark that why after 50? Remember our medicine said, laxity of the muscles. When the uterine ligaments becomes lax, with the age, the muscle tone becomes weaker. The same way, the esophageal tone becomes weak. The tone of the stomach becomes weak. The tone of the diaphragm becomes weak. At that time, the stomach pops out. So it's all related with the hormonal imbalance at menopause. So in terms of hiatus hernia, there are two types of hiatus hernia. One is sliding, which is very common. A small portion of the stomach and the area where the stomach joins the cardiac end of the esophagus join the esophagus, slides up into the chest through the hiatus. This is very, very common hiatus hernia, which has been observed in our routine practice. And the paraesophageal hiatus hernia is very rare. Hardly we can see. And if any patient having this paraesophageal, then it is dangerous as well, because it could cut off the blood supply to the stomach. I have never ever seen paraesophageal hernia in my 43 years of practice. I'm getting hiatus hernia. Sliding hernia is very common. Many patients, they come with the results, reports of endoscopy with the barium swallow and everything. But this paraesophageal is very uncommon type of hiatus hernia. So this is the picture of hiatus hernia, where you can see this is the esophagus, this is the diaphragm, and from the diaphragm, the hiatus hernia is popping out. And with this, a typical symptoms which I have observed is patient comes with a hiccup, because diaphragm is supplied by the phrenic nerve. And with the constant touch of this hiatus hernia irritates the diaphragm, and with the irritation of the diaphragm, phrenic nerve gets irritated, and patient is always coming with the hiccup, constant hiccup. If patient eats something bit spicy or some irritant or stimulant, patient starts developing a hiccup. And with the hiccup, the pantoprazole or omeprazole will not relieve, but our Nux vomica 1 dose, 2 dose will relieve the hiccup very quickly. That I have observed in my practice. So common symptoms of the hiatus hernia, they are primarily attributed to GERD, that is gastroesophageal reflux disease. Movement of stomach acids into the esophagus. Symptoms include heartburn, chest pain after food, abdominal pain at epigastrium after food. Majority of the symptoms being developed after food. Bitter or sour taste in the mouth or throat. Bloated, burping means eructations, water brush, and fetar oris means bad breath. Patient has absolutely very bad smell from the mouth. If patient having eructations, and if you are sitting near to them, then also you will be able to see that acidic, rancid smell from the mouth of the patient. Sometimes when you are examining the patients by telling him to open the oral cavity, at that time also you can see and you can smell the fetar oris. It also can lead to the tooth erosion, dysphagia, regurgitation, and belching. Severe chest or abdominal pain accompanied by nausea or vomiting, and inability to have proper bowel movement leading to the constipation. Etiology of hiatus hernia. What are the causative factors which can lead to patient to develop a hiatus hernia? That's also very, very important. Hiatus hernia occurs when weakened muscle tissue make the stomach bulge and push through the diaphragm. Majority of the time, in majority of the disease, in our book of medicine, we have come across etiology is idiopathic, means the exact cause is not known. And the risk factor could be aging. With advancement of age, muscles are losing their tone, as I earlier discussed. Weakened diaphragm, a large hiatus opening could be the congenital, patient born with a bit bigger hiatus opening, increased abdominal pressure due to the pregnancy, due to the obesity, severe coughing, or straining during bowel movement due to constipation, overweight, overeating, and pregnancy, frequent vomiting or coughing, ascites or abnormal collection of a fluid, also attributed to develop a hiatus hernia. Now, my observation. Why patient is developing hiatus hernia more in India? Because of the vigorous tongue cleaning. I have seen patient is so loudly, so vigorously cleaning the tongue. So if I'm living over here and one of the person who is cleaning his tongue at the 3, 4, 5 house away, then also I can hear that sound. Vigorous gargling that we have seen everywhere. Vigorous hawking while coughing. Vigorous coughing, it is mostly observed in India and are latent and predisposing cause of hiatus hernia. So any condition which can lead to the intra-abdominal pressure, intrathoracic pressure, or any changes in the pneumonic pressure of the esophagus can lead to the hiatus hernia, and majority of the time regurgitation. Homeopathically, gastroesophageal reflux disease is best treated with the acid group. In Latin, acidus means sour, and acid is always sour in taste. And the common symptoms of acid group is patient is irritable, mentally and physically. The physical symptoms is irritability at epigastrium, that is burning, that reflects in a form of burning. So irritable, mentally and physically, burning sensation at epigastrium and in stomach. Hemorrhagic tendency, patient having a hemorrhagic tendency, constant irritation at the gastric mucosa leads to corrosion, leads to erosion, and then it leads to ulcer. And from the ulcer, the blood vessel gets damaged and it starts causing bleeding. So there is a bleeding, hemorrhagic tendency with the GRD patient, as acrid, corrosive discharge and secretion. When patient vomiting is very foul smelling, vomit is acrid, corrosive, and patient also developing a sort of a weakness, debilitating condition. And the acid group having a vindictive tendency, spiteful, revengeful, and desire to hurt. If we look at the doctrine of signature of this acid is damaging the gastric mucosa. So desire to hurt. And common homeopathic remedies are acetic acid, antimony crude, argentum nitricum, atropine, bismuth. I'm getting very good results with the Feltori. Feltori in 3x potency actually, which is helping to reduce the cholesterol in a patients having a high cholesterol. but the failure is also helping the patient to overcome with the GERD, and my majority of the patients are very happy with the failure in 3x potency. Another medicine is muriatic acid, natrum carb, Nux vomica, pulsatilla, robinia, and sulfuric acid. So these are the general medication, general homeopathic remedies that what we can use in a patients having a complaint of hyperacidity, but it all depends on the constitution. Constitutional and miasmatic remedies are very, very important to treat the patient as a whole. So now we are coming to the miasmatic classification of esophageal disorder. As you all know very well that miasms are very, very essential and important makeup of a patients to reveal to select the right remedy. So let us consider a psoric patient. Psoric makeup first. What psoric patient represent to us when patient comes to the clinic? So patient gives us symptoms that patient is always hungry, even after full meal, no satiety, but the psoric patient will never put on weight as well. So excessive hunger and pica. Pica means abnormal craving for abnormal thing, like earth, chalk, half-cooked rice, uncooked rice, brick. Patient licks the wall, small children. Patient having an all-gone sensation in pulsatilla. All-gone sensation, especially those who are tea drinkers. Psoric patient also having a craving for sweets, heaviness with distension, heartburn, and water brush. Psoric patients are hungry and they eat beyond their capacity of digestion. Our stomach having a capacity to hold 1.5 kg, 1,500 grams we can hold as a food in our stomach. But when patient eats more than that, the capacity of stomach, they are crossing. And with that, capacity of the digestion has also been hampered. So when patients are hungry and they eat beyond their capacity, and when they are not able to digest, it always results in a regurgitation. It's an antiperistalsis. Psoric patient does not endure touch on abdomen, very sensitive to touch. Patient will not allow you to examine the abdomen. That are the psoric patients. Bilious nausea and vomiting coming on at regular interval. All symptoms of acidity and dyspepsia, nausea and vomiting, pain in epigastrium stomach are psoric. Slow intestinal peristalsis is also psoric. Constipation is also psoric, and craving for stimulant, tea, coffee, and tobacco. These are the makeup of psoric patient. And when you find all such type of symptoms in a one patient, you can put or you can categorize that patient as a psoric patient. Now we are coming to the syphilitic makeup. Syphilitic patient having a desire and craving for strong stimulant, tea, coffee, tobacco, and syphilitic patient having a hereditary tendency to alcoholism. As the patient suffer from nervous asthenia, weakness, so patient needs more and more stimulant. And that's why if we look in general to the alcoholics, they need more and more alcohol because they need more and more stimulant. They want to magnetize themselves. They want to stimulate themselves. So with one pack, they won't satisfy. So that's why they need another, third, fourth, like that. And they become habituated for that. Syphilitic patient can get colic, ulcer, esophagitis, gastritis, enteritis, colitis, all itis. Itis refers to the inflammation. And inflammation refers to the DNCRT, dolor, calor, rubor, and tumor, and functionaliza. Dolor means heat, Rubor means redness. Calor means dollar means pain. Sorry, dollar means pain. Calor means heat. Rubor means redness, and tumor means swelling. So dollar, calor, rubor, tumor, and functionalism means loss of function. So colic, ulcer, esophagitis, gastritis, enteritis, colitis, all itis, and it can lead to the cancer as a destructive miasm at later stage. Desire and longing for very spicy meat. Less spicy will be disagreeable to the syphilitic patient. So desire and longing for very spicy meat, desire for extreme cold food, and tendency for degenerative pathological changes. Perverted intestinal peristalsis is leading to gushing. Stool dysentery is syphilitic. Stool comes as a jet, and it's a syphilitic. Now coming to the psychotic. Psychotic makeup with gastroesophageal reflux disease patient having a cramping, colicky, spasmodic pain comes in paroxysm, interval, periodical, discomfort after eating, pain, colic in abdomen, compelling patient to bend forward, which we usually found with dysphoria patient, relieved by hard pressure and lying on abdomen. So when patient lies down on abdomen, patient feels pressure and patient is relieved by hard pressure. Craving for alcohol, table salt, pungent and salty food, cold or hot food, coconut, betel nut, well-seasoned food with salt and pepper. So this is psychotic patient. Aggravation from meat. Associated complaint is piles. And taste. Psychotic patient having a tendency to complain about the musty or fishy taste in mouth. Tubercular. Tubercular makeup of GRD patient is inability to assimilate much starch like potatoes. Pica means abnormal craving for indigestible things like lime, charcoal, earth, brick, and uncooked rice, half-cooked rice. Desire for tea, tobacco, alcohol, fatty, greasy, and salty food. Desire for milk, but unable to digest and aversion to meat. Tubercular patient having a lot of craving for the fatty, greasy, and salty food. And tubercular patient having a swelling of intestinal and mesenteric gland because of the tuberculosis. Laxity of the muscles leads to hernia. Duodenal ulcer is tubercular. Lymphatic involvement of the abdomen. Because in tuberculosis, all the lymph glands, lymph node gets involved. Greasy, bloody stool of the udder of rotten egg. This is very important. Patient complains that my stool smells very weird. And if you just explore more by asking that what type of smell, and if patient is eating egg, then patient will give typical symptoms that it's just like a rotten egg. So it also helps us to find a right miasm of a tubercular patient while history taking. So patient having a nausea before stool and weakness after stool. Bleeding for rectum leads to anemia, leads to weakness, and this is very important. If brain symptoms appear or disappear during diarrhea, indicates the presence of tubercular miasm. So this all about the tubercular miasm. Now, homeopathic key remedies with rubrics. So I have shortlisted some sensation and pain in throat during the heartburn. So if we look at the lycopodium, the Boric has written that burning, incomplete burning eructations rise only to the pharynx. They burn for hours. This is also very indicative symptoms of hiatus hernia. In boric, if you find a phosphorus, you will be able to see a symptoms like burning in esophagus, stricture of esophagus, rawness and soreness are characteristic. In materia medica pura, what phosphorus has been described with the GRD as sensation as if ball rising in throat. As if ball rising in throat. This is a very typical symptom which has been given in materia medica pura. And in belladonna, what Boric has written that contracted esophagus is dry and feels contracted. So these are the typical symptoms which you will be able to get from the patient, a patient having a hiatus hernia or GERD symptoms. Homeopathic key remedies with sensation. So patient comes with a complaint that choking sensation in a throat, that is pulsatilla. Choking pain in the esophagus as if a large lump of new baked bread had been swallowed. Pricking is a sensation. Patient described this pricking pain. So in Rostock, you will find that when swallowing and yawning both, there is a prick in her throat as if she had swallowed a needle. Scraping pain in a throat. In Nakswamika, scraping in the throat at the opening of the larynx as after rancid heartburn. Splinter-like pain in Argentum nitricum. Paroxysm of cramps in the esophagus, sensation of splinter in a throat on swallowing. Excoriation. In arsenic alb, it has been described beautifully that is useful in case of gulping of acid and bitter substance which seems to excoriate the throat. So here I would like to discuss about the bitter taste. Many times patient comes with a bitter taste of mouth. And in my history taking, I always ask my patient that, do you feel bitter taste in your mouth, or what about your taste? Do you relish your food normally, or you get some weird taste? And when patient says that I am having a bitter taste, even water is also feeling a bit bitter, then we should also consider the involvement of the hepatic factor, liver. Because whatever fat patient eats or whatever fat we eat, the fat gets emulsified and liver is secreting bile, and the amount of bile is too much because fatty food needs more bile for the breakdown of the fat. And when there is a too much secretion of the bile, one factor that patient will develop a gallstone. Second thing, with the more bile, more secretion of the bile, patient having a tendency to develop a bitter taste in mouth. So hepatic factor should be always kept in mind when patient is complaining of the bitter taste in mouth. So repertorial approach for esophageal disorder. When we repertorize and when we put a short of esophageal disorder is esophageal dysfunction, then we can come across all these things. The cuprum metallicum, you will in a throat, spasm of the throat and esophagus. Medicine will be cuprum metallicum. So I have given all the analytical and the real symptoms, real rubrics with the repertory that where we can find the remedy and what would be the symptoms with the clinical condition of GERD or esophageal disorder. So here, spasm of the throat and esophagus, cuprum metallicum, elapse. You can see the spasmodic contraction of this esophagus and pharynx, paralysis of esophagus, elapse, hemimelis virginia, varicose veins of the throat and esophagus. So when patient having a varicose veins, means tortuosity of the azygous and hemiazygous veins, which can lead to the severe bleeding, and we call that thing as a esophageal varices. The esophageal vein losing its tortuosity, and then it ruptures, and patient has a hematemesis, means bleeding of blood, bleeding of black, absolutely black, because of it's a venous blood. So that is hematemesis, and esophageal varices always gives clue that patient can get that black blood in the vomiting. So this all about repertorial evaluation of the esophagus. You can see the esophagus highlighted over here, and this will give a very wide spectrum of the selection of different remedies as per the patient's makeup, as per the patient's constitution, and which we can select as per the complaint of the patient. Here, throat, stomach, gastrointestinal burning, esophagus. Burning is a very common. Burning is very common with all the GERD patients. At last but not least, I will not take too much time. So really I appreciate for listening me.